Let's talk a little bit about prominent ears. So like most of these procedures, there's a name for the procedure to correct prominent ears. We call it otoplasty. And it's usually our younger patients, but we do have adults who come in with just very prominent stuck out ears that they've for years been either covering up with their hair or just embarrassed about. We can actually bring that ear back with an otoplasty procedure. Most commonly, we do this on kids, patients who are 5, 6 years old before they get in school, but when their ears have most of the growth, so that it's going to be a long-lasting procedure. How we do the otoplasty, it's not just removing skin behind the ear. We actually do come from behind the ear and make an incision, but we also use sutures to reshape the ear, to bring it back into a more aesthetic position where it's less noticeable. So the great thing about the otoplasty procedure is the incision is behind the ear, so it's really well camouflaged. And even though we're working on all the cartilage of the ear, reshaping it, you really don't see all that. It's all camouflaged from behind. So when we do the otoplasty procedure, we actually do use permanent sutures. So while there might be some initial relaxation, and hopefully that's very small, the long-term results, the results that you get, really should stay with you the rest of your life. For parents who have children with prominent ears, the question is, what's the right time to do it? And while there are some initial things you can do when a baby's born, typically that's not the focus. And patients are thinking more about these prominent ears when the child's 2, 3, 4 years old. The ideal time to do it is when they're about 5 or 6 years old, when their ear has really achieved most of the size it's going to have for the rest of the child's life, and before they start school, when they're often, unfortunately, get teased about it. So that's kind of the ideal time. We think about 5 or 6 years old for an otoplasty. So the otoplasty procedure, while it is surgery, is really fairly superficial. We're just working on the ear, so it's not a high-risk procedure. Most patients, when they do this procedure, can kind of get back to regular activities by 2 weeks. The biggest risk from this surgery is just aesthetically not getting it right. So it's a fairly low-risk procedure.